Hi, welcome to another episode of How to Do Atkins Low Carb. My name is, of course, Kent Altena, and this week's episode really came out of two different events that are happening in my life. One of them happens to be a neighborhood person as well as a fellow fireman on the team who developed cancer, and I happen to be wearing his a benefit shirt for him right now. The second event was me venturing into this vegan video and being consistently bashed, not so much for what I said or did, because obviously I'm more open to their lifestyle than they are to mine, or the presence of anybody following their lifestyle as they are to anybody following mine, but just that there's so many health defects, and despite me pointing out many studies to the contrary, they would not let the issue lie. And one of the things they happened to say was meat eaters were more prevalent to get these 11 different cancers. So the answer is this all for naught? Did I just exchange one health problem for another health problem? Did I just exchange obesity for the likelihood of cancer in the future? And if you go to Atkins Exposed website, you see that another Harvard study showed that women with the highest rate of animal fat to have 75% greater chance of developing breast cancer. As one Harvard School health researcher noted, because of the meat content, 2 years on the Atkins diet could initiate a cancer. It could show up as a polyp in 7 years and colon cancer in 10 years. So is it just simply exchanging one problem for another problem? And let's go to the January issue of Scientific American. Cancer is more prevalent, more frequent among those branches of the human race where carnivorous habits prevail. And to all these sorts of studies, relation does not necessarily equal causality. Let's take the study where carnivorous habits prevail, cancer is more prevalent. Well, what other habits might also prevail? Would eating processed foods and Twinkies also prevail? Would eating more junk food or eating out at McDonald's or Olive Garden happen to prevail than a third world nation in which those things don't necessarily happen? Is the environment different in where carnivorous habits prevail? That's one thing. Let's deal with the attitudes that simply plant eaters or vegans have less cancer risk than meat eaters. Okay, so let's imagine this. So we have the full group of meat eaters. And what habits might prevail in that group? Oh, I've just mentioned them. Obviously, they may live in industrial waste facilities. They may eat Twinkies. They may eat this. Okay, so we know that the standard group may have a lot of things going on with them that may cause cancer. Okay, so let's take this smaller subsection of group out of that main section. Well, let's think about what they do. Obviously, they've made a conscious decision for eating healthy or eating this specific way. What else might they be deciding in relation to that? Well, they may have also decided to give up some of the junk food in their diet. If they care enough to give up meat for whatever reason, whether it be ethical or they believe medicinal, what else might they also give up? Would they not also be the ones that might also give up other cancer-causing, potentially, activities? Cell phone, they may be ones that use hands-free more than the standard American. Who knows what they give up? Because causality within a cancer study is very difficult to assign. But if you're taking something from the whole and taking a small niche of them, it's probably easier for them to be designated a less risk group than the whole risk group. Anytime you take a niche from the whole, obviously you have the potentiality of improving one's risk factors for a potential disease. So let's take this a step further. That's all fine and dandy for trying to explain why there may be a negative risk studies or cancer studies out there for meat eating or animal fats in general, because who eats animal fats? Obviously not vegans, but also the people who might also be going to the Dodger game, having a Dodger dog, and having a beer and nachos with it. Well, what's to cause the cancer in that? Is it the beer? Is it the nachos? Or is it the bun around the hot dog? Or is it just simply the hot dog itself? It seems very convenient to just blame the meat eating as opposed to potentially everything else that might exist in their diet. So let's take this a different view on the issue. Let's separate all the other things and let's potentially look at a diet that may be strictly meat eating or have a higher prevalence of meat eating. Because surely those, if those are having a higher prevalence of animal fat in their diet, should have a greater risk factor for these things happening. So let's look at just those that with ketogenic diets, i.e. the Atkins diet. Effect upon a ketogenic diet to see if they enable or foster the growth of tumors. And back in the 1920s, the Nobel laureate Otto Warburg discovered that the tumors themselves specifically needed glycogen to grow themselves, that they couldn't metabolize themselves on any other macronutrient other than sugar. So they were basically sugar fiends that need this sugar inside their bodies to replicate and grow. Thereby, if you remove the sugar out of that system, the tumors often shrink or inhibit their growth. One of the other things that promotes tumor growth is the insulin growth factor. And how is insulin initiated or grows or released within the body? I.e. in relation to carbohydrates. So you have the two factors, i.e. if the tumors cannot be fed, which i.e. having a ketogenic diet reduces the overall amount of carbohydrates within the diet, and also having the body not releasing the insulin growth hormone, which thereby enables or fosters the tumor growth. You have a a double-edged whammy against cancer growth within the body. In fact, in 2007, the Women's Hospital at the University of Wartburg released a study. Dr. Melanie Schmidt and biologist Ulrike Kammer, both of the hospital, initiated a study with the severe terminal cancer patients. These cancer patients had pancreatic cancer as well as brain cancer. And they put them on a ketogenic diet. And those patients that could stick to the ketogenic diet actually saw decreased tumor growth and improved life expectancy due to the ketogenic diet. So let's look at specific diets. How does it help with specific diets? Because there are a number of studies that have been produced on ketogenic diets and cancer and specific types of cancer. For example, the scientist Zhao released a study called the Calorically Restricted Ketogenic Diet, an Effective Therapy for Malignant Brain Cancer. And what he showed that a ketogenic diet that was combined with carbohydrate restrictions showed a significant decrease in tumor growth in these mice. That the tumors were shrunken by over 65% on this calorically restricted ketogenic diet and 35% on a non-calorically restricted diet. And I'll put the link in the show notes over to the right hand side. And there was also another study called The Effects of a Ketogenic Diet on Tumor Metabolism and Nutritional Status in Pediatric Oncology Patients. And these were showed that the most effective way to inhibit tumor proliferation should be to block the generation of energy for tumor growth. Talking exactly what I just said was if you remove the tumor growth mechanism, i.e. the sugar out of the system, you prevent the tumors from increasing themselves. In that study, at the University Hospitals in Cleveland, 2 female patients in advanced stages of astrocytoma tumors, which are the most common brain tumor or spine tumor within the body that are very typically slow-growing tumors. Within 7 days of initiating the ketogenic diets, blood glucose levels declined to normal levels, and the blood ketones were elevated to 20 or 30-fold. Results of the PET scan indicated a 21.8 50% average decrease in glucose uptake in the tumor site of both patients. One patient exhibited significant clinical improvements in mood and new skill development during this patient. So by shrinking the tumors, these people were actually able to better function from their brain cancers. And their conclusion, while this diet does not replace conventional cancer treatments, these preliminary results said if you combine the two, you could better see future results. And finally, there was another study with brain cancer, drug and diet synergy for managing malignant astrocytoma in mice, 2-deoxy-D-glucose, and the restricted ketogenic diet. And their conclusion was that the astrocytoma growth was reduced more in the ketogenic group than when combined with the drug than in either group individually. So by combining the two, there was a synergy of the two cancer treatments, and this results suggest that management of malignant astrocytoma with restricted ketogenic could be enhanced when combined with drugs that inhibit glycolysis. So by using drugs that inhibit the sugar uptake, you thereby reduce the sugar growth. And if you reduce the sugar out of the system, you even further reduce the sugar growth. Okay, so that's great. Brain cancer's awesome if you go on to a low-carb diet. What about other cancers? What about breast cancer? That was specifically referred to in the Atkins Exposed link that I talked about earlier. And there was a study released by Lancet on the intake of macronutrients and the risk of breast cancer, and here was their findings, that the risk of breast cancer decreased while increasing the total fat intake, whereas the risk increased while increasing the intake of carbohydrates. So in their study, that they found that as you increase the amount of carbohydrates in your diet, you actually increased your likelihood of cancer, breast cancer. And if you increase the animal fats in your diet, you actually decrease the amount of likelihood of cancer. And thereby, what does that lead me to believe? I.e. that a ketogenic diet would be a great thing to prevent the onset of breast cancer. I'll put another link in the show notes on another breast cancer treatment. Okay, so we know that it's good for brain cancer, to prevent the development of breast cancer. Are there any other cancers that it might be better for? How about gastrointestinal cancer? In 2008, there was just a study released called The Growth of Human Gastric Cancers in Nude Mice and is delayed by a ketogenic diet supplemented by omega-3 fatty acids and medium-chain triglycerides. In this study, the 24 female nude mice were subjected to subcutaneous cancer cells called adenocarcinoma, and the animals were randomly split in two feeding groups. One either fed the ketogenic diet and one fed a normal high carbohydrate diet. And what were their results? That the tumor regrowth in the ketogenic diet were significantly delayed than the standard diet. Importantly, the tumors revealed a significant larger necrotic areas than the tumors of the standard diet groups, with the vital tumor cells appeared to have fewer vessels than the tumors of the standard diet group, i.e. the antiogenic effect that I talked about earlier, probably from the lower insulin growth factor. And I'll be pointing to another study by Rudolf Katz that kind of support that insulin growth factor approach. So what does all this say? As my phone beeps at me. That one, being on a ketogenic diet probably does not support a cancer cells or a cancer environment. That being on a ketogenic diet, one certainly does not promote it, and two, if anything, restricts or inhibits the growth of many cancer cells. And the second thing I'd like to just reiterate was that the cancer studies that are out there that divvy up the world into a plant-eating group and a meat-eating group, well, that eliminates a lot of the diversity amongst the what I would like to call the meat-eating group or the just simply standard diet group, i.e. what does that standard diet eating group do? So as you are reading these reports about studies that show that vegetarians have less cancer, use your brain, understand what they're comparing, and read the study for what it really is. Did they really determine causality, or did they really determine relation? And in terms of relation, determine if it's actually a plausible relationship. Did they try to do the nth degree of proving out that this relationship is just a comparison of A versus B, or is it a comparison of A versus B versus C versus, going to the nth degree? Did they attempt to eliminate all the variables within the environment, or did they just simply take one niche group out and compare it to the whole? Well, I hope this reaches everyone in good health, and good day. Bye.